Hi, my name is Erin, and I will be talking about a news resource from CBC News that is associated with our health concern.
Hi, I'm Reagan, and I will be examining the philosophical lens used in the research we found.
Hi, I'm Singhi, and I'm going to talk about the nursing implication of our health concern.
Hi, my name is Riley, and I'm going to be discussing the peer-reviewed articles we found relating to this topic.
Hi, my name is Mishka, and I'm going to talk about the cultural implications related to our health concern.
Today, we will be discussing the marginalization of indigenous groups within healthcare settings.
We will also be briefly mentioning the medical ailments Indigenous communities are often prone to, such as high mortality and suicide rates, as well as food insecurity and poverty.
On September 28, 2020, a 37-year-old Canadian Indigenous woman, Joyce Eshkwan, died at the Joliet Hospital in Montreal after being mocked and verbally assaulted by hospital staff. When she was admitted to the hospital for stomach pains 2 days before she passed away, her family believed the hospital staff had administered too much morphine, despite her concern for being allergic to the medication. In the live-stream video that surfaced on social media, Joyce was heard screaming in distress and repeatedly calling for help. Although Joyce had a clear indication of pain and suffering, hospital staff continued to ignore her and taunted her with racial slurs. Joyce was told she was stupid, good for sex, and that she would be better off dead. She died shortly after posting the video online, and politicians have stood up for Eshkwan's death since. For years, there have been multiple incidents that have emerged which displays evidence of racism of Indigenous peoples in Canada's healthcare system today. The marginalization and discrimination against Indigenous people contribute to the inadequate healthcare they receive and remains prevalent within the healthcare system. The inequities faced by Indigenous people results in poor health outcomes, which contributes to the lower life expectancy and higher rates of chronic diseases among Indigenous people. These actions are rooted in government policies that encourage segregation, and further negative stereotypes have created an unconscious pro-white bias among healthcare workers. This incident forces a reckoning on racism and marginalization of Indigenous peoples in Canada. Federal and provincial governments claim they are taking action to address systemic racism against Indigenous people. However, it is our job as nurses to take on a leadership role to promote social justice and equity and prevent embedded racism from causing further harm to patients and communities.
The first peer-reviewed article that we found that supports our hypothesis is a quantitative study on the Toronto public health system. The study uses a respondent-driven sampling method to measure the amount of prejudice and mistreatment of First Nations people in the health system. After adjusting their data for the sampling method used, the study found that an estimated 27.3% of First Nations people in Toronto had unmet health needs in the past 12 months before being interviewed. They also found that an estimated 28.5% of First Nations people had experienced a form of healthcare discrimination in the Toronto healthcare system. They also found that about 63.1% of First Nations people had access to a general healthcare provider. This is quite concerning, as this means only about 1/3 of First Nations people in Toronto have access to a general healthcare provider. This can lead to a slew of problems and concerns. On top of this, the study also found a strong relationship between discrimination in the health system and unmet health needs in the First Nations population. They also found a strong relationship between the lack of a healthcare provider and unmet health needs in the First Nations community. This study shows that a healthcare system more welcoming and understanding of First Nations people would not only bring more people into their hospitals, but also vastly improve the health of many people. The second peer-reviewed article we found that supports our hypothesis is a review of First Nations health and the legislation behind it. This review found that on average, First Nations people statistically have an alarming amount of health complications. Some of the top causes of mortality in First Nations communities are injury, poisoning, circulatory diseases, cancer, respiratory diseases, and chronic diseases, strikingly diabetes. Diabetes occurs in First Nations people at up to 5 times the national average, with the highest rates occurring in those living on First Nations reserves. The leading cause of death for First Nations people up to age 44, however, is self-injury and suicide. First Nations males aged 15 to 24 years old have a suicide rate of 126 per 100,000, compared to 24 people per 100,000 for non-Aboriginal males. The First Nations female suicide rate is 35 people per 100,000, compared to just 5 per 100,000 for non-Aboriginal females. A large number of these health issues stem back to legislation that includes First Nations people. The only national level legislation active today that is specific to First Nations people is the Indian Act of 1876, which gave responsibility for First Nations healthcare to the federal government. In comparison, for the general Canadian, healthcare lies with the responsibility of the provincial government. While general health was being developed at the provincial level as soon as the mid-1800s, the healthcare of First Nations people has always lied at the national level, even to today. This causes a sense of legal ambiguity for First Nations health, as it is difficult to know which health policies apply to First Nations people and which ones do not.
Hi, I'm Reagan, and I'm going to be discussing the philosophical approach used in the research we found and also making specific reference to Erin's article she found about the Indigenous woman who was mistreated in a hospital in Montreal. So the news article Erin found talks about an individual case, but also the larger issue at hand, which is the discrimination faced by Indigenous people in the healthcare system. Now, this is a perfect example of critical social theory, as it examines critically the power imbalance and oppression faced by a marginalized group in the healthcare system. In the article, there's actually reference to a report that found that, and this is a quote here, "It is impossible to deny Indigenous people in Quebec are victims of systemic discrimination in accessing public services, including healthcare services." So this is another example of critical social theory, as it's representing how a marginalized group is oppressed in the healthcare system. So I think using critical social theory in this article actually enhances the effect of it, because it allows us to look at the larger picture here and the larger issue at hand, which is the inequities faced by Indigenous people in Canada. Now, there is a long history of Indigenous people being mistreated in Canada that stems back to colonialism, which can still be found nowadays, and cultural assimilation and residential schools. In fact, there are actually medical ailments that are more commonly found in Indigenous societies than in urban societies as well, such as high suicide rates. What I think is missing is other stories that emphasize the issue at hand, other specific examples, because this would just emphasize the importance and the need to act on the discrimination faced by Indigenous people in the healthcare system.
Canadian Aboriginal community held a traditional way of life, where they rejected modernization in some aspect of life. First, residential school and health. For many decades, the Canadian Indigenous people had received a flawed education system offered in the residential school. The residential school was constructed as a place to isolate the Aboriginal people of Canada. The colonial master, however, was not interested in developing the region inhabited by the Indigenous community. There were no hospitals constructed in the Arctic region where Aboriginal people lived. Lack of hospitals and development in this Arctic region led to the Aboriginal people's isolation for many years. The government concentrated on the health of non-Indigenous people. The region for a long time had no physician and material required in the hospital. Many deaths were reported in this area as compared to other regions of the country. Second, Aboriginal culture consideration. The community's cultural beliefs in traditional health also affect their health status. The community used herbal medicine and rejected modern medicine. Aboriginal community consult traditional healers who were elder of the community. They believe the illness was caused by ignorance of scarce natural law. Lack of health resources was not taken as a significant health problem.
Earlier, we have presented the different concern that this population faces and its appearance that the government policies and stereotypes of healthcare workers are the main reason to blame. Therefore, what we can do is to motivate our nursing association to inform lawmakers on policies that needs to be changed, so that these policies are inclusive of Indigenous people. Another is to collaborate with the Ministry of Education to make education of healthcare workers focused on the needs of these people. In summary, we need to play our role of being the advocate of our patient.